Are there particular PDTs designed for the unique needs of the elderly? What a great question. Or those with cognitive challenges which may challenge intricate technology? What I can tell you is the Endeavor RX therapeutic video game, believe it or not, was tested initially. It was initially designed for elderly patients with cognitive impairment, dementias, if you will, and showed evidence of efficacy there. So in that case, yes, there are some data on that population. And if you want to go and talk to the folks from Achille Interactive who are here, they can tell you where that stands. It hasn't been specifically cleared for that indication, but there is evidence of both efficacy and safety. As far as the other PDTs, I don't know offhand if they've specifically been tested in elderly folks or if they've had to make any design changes. But that is a really important and great question. And hopefully what's going to happen is as payers jump on board and as we are able to use these more and get them covered, the companies then will have more revenue. More money means they can do more studies, and that's what it's all about. Can older kids or even adults benefit from Endeavor RX? Excellent question. There is now a trial underway in adults, so we will know soon. Older kids, sure, absolutely can. We had some adolescents in the trials. Okay. Is Somryst meant for people not on sleep medication? Is it as effective for patients that are already on sleep medication? The answer is it is meant to deliver CBTI either I shouldn't say standalone, either by itself or with medication. So with or without medication is the answer. It was not studied with medication, but I know it can be used that way. And of course, think about it. When we prescribe sleep medications, don't we also talk about sleep hygiene and things like that? So really, you know, the best outcomes very often for psychiatric conditions are a combination of medication and either psychotherapy or lifestyle and other interventions. I like to say, if you were treating diabetes, would I give you insulin and say, go ahead and eat all the chocolate cake you want? Sit around and watch TV? Don't exercise? No, of course, we would talk about those things. Not funny, huh? It was funny when I rehearsed it this morning, but all right. PRISM for anger management if it targets the amygdala. Wow. That makes complete sense. So my answer is absolutely. I just don't know that it has been specifically studied by that. But sure, of course, intermittent explosive disorder, if you will, any kinds, and as we know, impulsive anger, impulsive aggression. Hopefully you heard Vlad Maletic's tremendous talk on Thursday about neural circuitry. And just a quick shameless plug, Vlad and I are talking about anhedonia. And Vlad this morning, we met for breakfast. Vlad gave me a sneak peek about something he's going to talk about called the Las Vegas circuit. It has to do with impulsivity in the brain. How's that for a teaser, huh? We're going to be speaking in the Colorado Ballroom. Anyway, that makes perfect sense because the amygdala and the locus ceruleus, of course, are driving this. Any specific assessment scales to use in assessing digital therapeutics effectiveness? I would say you would use the standard scales. As you saw, for instance, the insomnia index is a very standard rating scale. So you can use standard scales. For instance, in the depression study Otsuka is doing with Click Therapeutics for CT152, they are using standard depression scales, MADRS and others. So you can use any rating scale you would normally use for whatever the indication is. Well, you can use the ADHD-RS for Endeavor RX, for instance. Are children with gaming use disorder contraindicated? Wow, cool question. The answer is no. In the it's actually called IFU, in the instructions for use, which is kind of like the package insert prescribing information. There's no contraindication for that. Because remember I said it shuts off automatically. So at 30 minutes, you can't keep using it forever. One of the posters suggested, sorry, can you go back to that question? Yeah, one of the posters suggested gaming use disorder can worsen ADHD symptoms. There's no question. It's a bidirectional street. We know ADHD is a disruption of the dopamine system. Dopamine is pleasure, motivation, reward, and impulsivity. So of course those two interact. And I like to say one of the symptoms of untreated ADHD is any kind of compulsive overuse. So substance abuse, internet, gaming, sex, compulsive sex, food, anything like that is associated with ADHD. Okay, next. Can free Spira be used beyond 28 days? Great question. I actually don't know the answer to that offhand, but we can find out from the company, of course. All right, next. Are any of these PDTs available as OTC versions or a prescription required? Well, what is the name? PDT, what does the P stand for? Yeah, you get? So no, of course, these are prescription digital therapeutics. Prescription is required. Of course, there's lots of OTC, if you will, apps for various things. The difference is they're not tested. So they have great marketing. They may look theoretically good, but we don't have data to suggest that, either on efficacy or safety, for instance, which has to be done if you go through this pathway. It's a very good question. I didn't mean to poo-poo it. How does a patient submit the prescription and get the program, and how do I get the report of their use? Great question. It does vary by the intervention. But in general, this is the way Pear used to do it, was you'd write the prescription, and there was a website they would go to, and you wrote the prescription, and the patient would go online and get a number, you know, like a key that would unlock the app, and they could download it. So there's a way that they go through, and then there's software that you can get that's the dashboard that is HIPAA compliant and connects with the app, and so the information comes to your dashboard and you can look it up. Okay, how do we get patients to use them consistently? How do you engage your patients in any of your treatments? No, I mean, I don't mean to be serious. I mean, it's all about the relationship. It's about describing the potential benefits, the potential risks, reassuring people, telling them what to expect. I think it's the standard principles of improving adherence and engagement with any therapy. I think one of the issues here is also make sure you understand your patient's concerns and address them, and to have a good relationship so they can tell you how it's going. Can you please explain the mechanics of how you prescribe and use these with our patients? Some are not super tech savvy. I explained that a little bit. It does differ, so you would want to talk to the company and get the specifics for each one of these. It's a little different for each one. Believe me, they realize that many of us are not tech savvy. And so, for instance, in the case of EndeavorRx and the Pear, I've worked with them on their development, and I know that they've gone through several modifications based on working with us to make them easier to use. When appropriate, I like to experience the assessments and treatments I provide. Is it possible? Yes, to get these and try. Yes, I actually have EndeavorRx downloaded on my phone, and I've played it. So yes, go talk to the companies again, and you can do that, absolutely. Can these therapeutics be prescribed by licensed clinical psychologists? Yes. That was an easy question. And that's why I said it doesn't have to be a medication, a licensed medication. It's a licensed healthcare provider, which is really, I think, a nice benefit as well. And again, expands access. Can you speak to the app, CBTI Coached, developed by the VA, released to the public compared to Somnus? I have nothing to say about comparison, except this is not, to my knowledge, was not through that pathway. It's not a prescription digital therapeutic. That doesn't mean it's less effective, better, or worse. It's just we don't have as much data. So I just don't know the difference other than that. I don't have any experience with that one. But it may be very good. I mean, if it's delivering CBTI, that's a good thing, if it's doing it appropriately. Are PDT services billable? Do we know if Medicaid will cover? That's what I've said before. At this point, not very good coverage. This is something that we think will increase over time. I do hope that payers jump on board. I think they will eventually. Some of these are not covered by insurance, but they are expensive. How do you handle that as a clinician? Please talk to the companies, as I said. Some of them now have assistance programs or ways to get discounts. They want you to get experience with them, which only makes sense. So, and this is just going to improve over time as we use them.